Hi guys, I thought I would um, just start uploading some different breathwork techniques that might be nice for people because I'm on an expansion of my breathwork practice, doing a new training course around conscious connected breathwork. And this week we had our first go at doing more of the standard kind of breathworks that you'll have seen me do over the years, those of you who know me. So I'm just going to go through a square breathing technique. And first of all, I think it's important to just think about what the benefits are for square breathing. So it activates our parasympathetic nervous system, our rest and repair, which reduces stress, calms the body, and lowers heart rate. It can be really good for focus and concentration, which is something that I certainly benefit from. It can be helpful in reducing intrusive thoughts, improves attention and mindfulness. It's really good for emotional regulation. I use it often with my clients, brings balance, reduces anxiety, and can ground during periods of feeling overwhelmed. It can actually be really useful for performance support. Lots of athletes use it, people in the military, other professionals, anyone who needs to stay calm under pressure. And I use it at night too when I'm struggling because perhaps I've got something on my mind, I've got stuff going on, I've got those thoughts racing, as well as pressing and holding on my meridian points used in EFT. I'll also use square breathing to slow my racing thoughts, to settle, and to get into rest. In terms of any contraindications and cautions, um, it's better during pregnancy, particularly first trimester and last trimester, not to do long breath holds. But since we're only going to be holding for the count of four, it should be perfectly safe to do. If you've got any concerns, check with your GP. Good in terms of if you've got COPD, asthma, any recent chest infections, you can proceed with caution and just be more careful around the holds. If you've got any cardiovascular conditions, hypertension, arrhythmia, recent cardiac events, avoid longer holds and definitely discuss it with your GP. If you've got a history of trauma and panic attacks, I find in my work that holding the breath might feel quite triggering, especially for even the count of four can feel too long. Sometimes I adapt the square breathing and create kind of more oblong breathing where we hold for two rather than four and breathe in for four and out for four. Um, I find that that can just be um, a better step to take first of all when you're embarking on something new. If you get any dizziness or lightheadedness, then you can pause, just return to your natural breathing. That'll be absolutely fine. So we're going to do this for about 10 to 12 sets, depending on my ability to count. And I'm going to talk you through it. So I'm going to be breathing in through the nose, pausing for four, breathing out through the nose or the mouth and pausing for four. And it's all going to be four, 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 hence the square breathing, almost like you're going around the outside of a square. Okay. Breathing in, 2, 3, 4, and pause, 2, 3, 4, and out, 2, 3, 4, and pause, 2, 3, 4. Breathing in, 2, 3, 4, and pause, 2, 3, 4, and out, 2, 3, 4, and pause, 2, 3, 4. Breathing in, 2, 3, 4, and pause, 2, 3, 4, and out, 2, 3, 4, and pause, 2, 3, 4. Breathing in, 2, 3, 4, and pause, 2, 3, 4, and out, 2, 3, 4, and pause, 2, 3, 4. Breathing in, 2, 3, 4, and pause, 2, 3, 4, and out, 2, 3, 4, and pause, 2, 3, 4. Breathing in, 2, 3, 4, and pause, 2, 3, 4, and out, 2, 3, 4, and pause, 2, 3, 4. Breathing in, 2, 3, 4, and pause, 2, 3, 4, and out, 2, 3, 4, and pause, 2, 3, 4. Breathing in, 2, 3, 4, and pause, 2, 3, 4, and out, 2, 3, 4, and pause, 2, 3, 4. Breathing in, 2, 3, 4, and pause, 2, 3, 4, and out, 2, 3, 4, and pause, 2, 3, 4. Breathing in, 2, 3, 4, and pause, 2, 3, 4, and out, 2, 3, 4, and pause, 2, 3, 4. Now just return to your natural breath, allowing your system to just notice anything that's going on in your body. After giving yourself these moments of time just to pause, notice the breath, engage with the session. And maybe you want to comment on this video, anything that you've noticed. And if not, that's cool too. I hope you found it helpful. See you again soon.